There's absolutely no medical reason for me to be sitting here today. In June of 2020, I was diagnosed with tonsil cancer, stage 4, inoperable. And I went through chemo and radiation, finished that in September 2020. In October of 2020, I actually had an artery in the back of my mouth, and it actually, where they shrank the tumor, it burst. And I had a massive bleed. I had several times that the side of my face, the side of my head would swell up, and I'd have to go to the hospital. So I was in and out of the hospital from that period about 5 times. And most of the time it was at least a week in the hospital. When they went in to do surgery, he said he could, really the only way to fix it was just to go in and reconstruct everything. He rebuilt my jawbone, the gum, and the joint, and then patched my neck here also. My HR department here at the sheriff's office, they knew what was going on and what I was going through, and they sent me a link for Goldfinch. A few weeks into the interacting with Abby and Goldfinch, I told her that, I was skeptical at first.
Robert was someone who fully embraced the Goldfinch Health program, and like he said, he was skeptical at first, and he admitted that to me, but and when he got into it, he fully embraced it and was a very active participant in the program. My role with the patient before surgery involves a lot of education. We want to make the patients feel as prepared as possible for what they're about to face. So we do a lot of education surrounding the procedure that they're going to be having, and then also additional education for enhanced recovery protocols. Enhanced recovery really focuses on a multimodal approach to pain management after surgery. I don't know if people realize that there is another way to manage their pain afterward, using non-addictive pain medications in conjunction sometimes with the opioid to manage the different types of pain that they might have after surgery. It is absolutely possible to have better pain management with fewer opioids using a multimodal pain management approach.
Going into it, I was under the assumption that it was just for the opioid and the pain medicine management was what my impression of it. But I learned pretty quick that it was more than that. It helped me probably more on the mental and emotional side than it did actually the pain management side.
Patients are coming to surgery and they don't have the full picture. They have lots of questions that their doctor may not have had time to go over with them. So I feel like our program can help fill in the gap of knowledge and to better prepare our patients for surgery. I would say overall our Goldfinch patients feel more prepared for surgery and know what to expect in recovery and have better outcomes because of this.
It was like having a 24/7 nurse. Even though we didn't talk every day, I knew that if I needed to ask something, or if I didn't understand something, I could ask her. And it was just, she's just a wealth of information. She actually helped me realize, that, hey, I can have a life after this, right? I can go on and I can be happy.